Okay, let's try and untangle this. For many of us looking at retirement, or maybe already there, the whole world of prescription drug coverage can feel like just an impossible maze, right?
Yeah.
We're talking thousands of dollars potentially every year for medications you absolutely need. And the sheer complexity, especially with Medicare Part D, it just adds to the stress.
It really does.
But what if we told you there are actual concrete strategies, surprisingly effective ones, to turn that kind of overwhelm into real savings and, honestly, peace of mind?
That's exactly right. And while the system, yeah, it looks incredibly complex from the outside, what our sources show is that it's actually designed with, well, multiple pathways for you to optimize it.
Ah,
So today, our deep dive into your material is focusing precisely on how you can strategically manage those prescription drug costs, through Medicare, other options too, making sure you get the care you need without that financial hardship. Our mission here is really to pull out the most important bits of knowledge, the practical shortcuts, turn that confusion into clarity, and maybe find a few surprising things along the way.
okay, so let's start right at the beginning then. What exactly is Medicare Part D, and why does it always feel like there's some new hoop to jump through?
Well, fundamentally, Part D is a voluntary prescription drug program. It started back in 2006.
Okay.
And the key thing right from the start is that it's delivered through private insurance companies.
Not directly from the government then.
No, exactly. You're picking a plan from an insurer. It might be a standalone prescription drug plan. They call those PDPs.
Right.
Or it could be integrated into your Medicare Advantage plan. That's Part C, sometimes called an MAPB.
And it's not just like one simple cost structure. I hear about these different phases, almost like stages your wallet goes through each year.
You got it. Understanding these phases is absolutely critical because your out-of-pocket costs, they can swing wildly between them. Think of it like a road trip, maybe, with different toll booths and maybe some rough patches.
Okay, I like that analogy.
So first, you got the deductible phase. Here, you're paying the full cost of your drugs until you hit a certain amount.
Right.
Then you enter the initial coverage phase. Now you and your plan are sharing costs. Usually you pay a copay or maybe coinsurance.
Okay.
After that, we hit the coverage gap. That's the one most people know as the donut hole.
The infamous donut hole, yeah.
And finally, if your drug costs get really high, you reach the catastrophic coverage phase. Now the important part. This whole journey resets every single calendar year,
Every January 1st.
every January 1st,
Yeah.
which means that annual enrollment period in the fall, that is your absolute best time to optimize your plan for the next year.
So, knowing this journey, what kind of vehicles, sticking with your analogy, can we take? You mentioned standalone plans and Medicare Advantage. What are the sort of the main differences?
Yeah, good question. You've basically got two main routes inside Medicare. First, those standalone Part D plans, the PDPs.
Okay.
These are generally for folks who stick with original Medicare, that's Parts A and B.
Got it.
PDPs focus only on drugs. And you can pair them up nicely with a Medigap policy for really comprehensive coverage.
Mm-hmm.
And what our sources point out is these PDPs typically offer the widest variety of plan options, more choices for you to match your specific drug list.
More flexibility, maybe?
Potentially, yes. Then you have the Medicare Advantage plans with drug coverage,
Ah,
the MAPDs.
right, the all-in-one plans.
Exactly. They bundle your medical and drug benefits, often for a lower overall premium. They're convenient, one card, one plan.
Yeah.
The trade-off, though, can be that they might offer fewer specific drug plan choices within that one insurance company's offerings. So maybe a bit less flexibility on the drug side compared to searching all PDPs.
So it's really not just choosing any plan, but the right type of plan structure for your whole health picture, not just the prescriptions.
Precisely.
Are there other places people might find drug coverage? Things beyond Medicare that maybe get overlooked?
Oh, absolutely. And it's really vital to look at these. Sometimes they offer better benefits or extra help.
Like what?
Well, many retirees actually keep prescription drug coverage through their old employer or maybe a union plan.
Oh, interesting.
If you have that, the critical thing is to check if it's considered creditable coverage.
Creditable. What does that mean?
It basically means the coverage is, on average, at least as good as a standard Medicare Part D plan.
Okay.
Confirming this is super important because it helps you avoid potential lifetime premium penalties if you decide you want to enroll in Part D later on.
penalties. Nobody wants those.
Definitely not.
Oop.
And also, something that surprises people, a number of states actually offer state pharmaceutical assistance programs, or CIFPAPs.
CISPAPs.
Yeah, these can sometimes supplement your Medicare coverage, or even provide full coverage for people who might not be eligible for Medicare yet. They often target specific groups or specific high-cost medications and can save you a lot. Worth checking your state's Department of Aging or Health website.
Good tip. Okay, so if Part D is the map, you mentioned the formulary earlier. That sounds like the crucial legend, right? Getting that wrong could cost things. What exactly is it?
You nailed it. The formulary is a legend. It's simply the list of medications your specific plan covers. But here's the key part. It's organized into tiers.
Tiers, okay.
And each tier has a different cost for you. Think of it like maybe airline seats again. First class costs more, economy costs less.
But they all get you there.
Hopefully. Typically, you'll see about 5 tiers. Tier 1 is usually preferred generic to the lowest cost. Then maybe Tier 2 for other generics. Tier 3 might be preferred brand name drugs.
Okay.
Tier 4, non-preferred brand names, more expensive. And Tier 5 is usually specialty drugs. Those are the highest cost for complex conditions.
And it's not just the drug, but where you buy it can matter too.
Absolutely. Quick tip there. Plans have preferred and non-preferred pharmacy networks. Using a preferred pharmacy almost always means lower copays for you.
Lots of little details. So what's the big takeaway here? How does understanding this legend, this formulary, actually save money?
Oh, there's a huge opportunity. What the sources consistently show is how often just a small tweak, maybe asking your doctor if you can switch from say a Tier 3 preferred brand to a Tier 1 generic in the same class of drugs, can save you literally hundreds, maybe thousands, a year.
Without impacting your health outcome.
If it's clinically appropriate, yes. Generic substitution is probably the single most effective strategy. Generics have the same active ingredients but can cost 80, even 90% less.
Wow.
Also, think about therapeutic alternatives. If your exact drug isn't covered or it's on a really high tier, ask your doctor if there's a similar drug in the same class that is covered better and would work just as well for you.
But that requires talking to your doctor, obviously.
Oh, absolutely. You never make these changes on your own.
Yeah.
It has to be a discussion with your healthcare provider to make sure it's the right medical choice for you.
Okay, now, the infamous donut hole. That phrase alone, I think for many people, it just strikes fear into their retirement budget. What is it? And maybe more importantly, how has it changed? Is it still the kind of financial black hole it used to be?
That is such a great question because you're right, the fear around the donut hole is often based on, frankly, outdated information.
Okay.
Traditionally, yes, it was a period where your share of the drug costs jumped up significantly. It kicks in after the total amount spent on your drugs, both what you've paid and what your plan has paid, reaches a certain limit. For 2024, that initial coverage limit is $5,030.
So once you hit that $5,030 in total spending,
You enter the coverage gap, or donut hole. Now, in the past, you paid a much higher percentage. But here's the crucial update. Thanks to legislative changes, primarily the Affordable Care Act and subsequent actions, the burden and the gap has been significantly reduced.
okay, so it's not the void it once was. How exactly did it change?
Not nearly. Now, while you're in that gap phase, you pay no more than 25% of the cost for both generic and brand name drugs.
Only 25%. That's much better.
Much better. And here's another key improvement. For brand name drugs, the manufacturer actually provides a 70% discount while you're in the gap.
A discount from the drug company.
Yes. And critically, the full price of the drug before that discount, plus the portion you pay, counts towards getting you out of the donut hole and into catastrophic coverage faster.
Ah, so that discount helps you move through the gap quicker.
Exactly. It helps you reach that catastrophic coverage threshold, which for 2024 is $8,000 in actual out-of-pocket spending sooner.
So what are the strategies then for managing this 25% phase?
Well, proactive strategies help. Things like maybe timing non-essential medication fills if possible, definitely utilizing any manufacturer discount programs available.
Right.
And again, talking to your doctor about those generic or lower-cost therapeutic alternatives we discussed, that can make a huge difference in how much you spend before you even hit the gap.
All right, so we understand the landscape, the phases, the donut hole isn't quite as scary. When do we actually, sign up or make changes? Is there a perfect time?
Timing is crucial. There are really two main windows you need to know about. First is your initial enrollment period.
When you first become eligible for Medicare.
Exactly. It's a 7-month window that typically starts 3 months before the month you turn 65 includes your birthday month,
Mm.
and ends 3 months after.
Okay, 7 months.
Missing this window, unless you have other creditable coverage, like we talked about from an employer,
Right.
can lead to a lifetime late enrollment penalty, a higher premium for Part D forever.
Ouch. Okay, so don't miss that initial window. What about for people already on Medicare?
For everyone already enrolled, the key time is the annual open enrollment period. That runs every year from October 15th to December 7th.
Okay, fall enrollment.
That's your main opportunity each year to review your current coverage, compare it with other plans available in your area, and switch plans if you find a better fit for the upcoming year.
But honestly, with potentially dozens of plans available in any given area, how do you even begin to compare them effectively? It just feels overwhelming.
It absolutely can feel that way. I think the single most important piece of advice from our sources is this. Analyze your total estimated annual costs, not just the monthly premium,
Total cost.
meaning you need to factor in the plan's premium, its deductible, the copays or coinsurance you'll pay for your specific drugs based on their formulary tiers,
Mm-hmm.
and estimate what you might pay if you reach the coverage gap. It's the whole picture based on your actual medication list.
Okay, so you really have to input your specific
Yep,
drugs.
you absolutely do. And thankfully, there's a great tool for this, the Medicare Plan Finder tool on the official Medicare website, medicare.gov.
Ah, the government site.
Yes, it's a standardized resource. You
Yeah.
plug in your zip code into your specific prescriptions and dosages, select your preferred pharmacies,
Okay.
and it will show you a list of available plans in your area, ranked by your estimated total annual cost. It does the math for you.
That sounds incredibly useful. So it's not about chasing the absolute lowest premium number you see advertised somewhere.
Exactly. A plan with a zero premium might have a high deductible or put your key medications on expensive tiers, costing you way more overall than a plan with, say, a $30 monthly premium, but better coverage for your specific needs. Look at the total estimate.
That's a huge shift in thinking for a lot of people, I bet. Okay, so beyond picking the right plan using that tool and understanding formularies, are there other, maybe slightly more advanced, savvy moves or hacks people can use to save even more?
Yes, definitely a few more layers we can peel back. Think about 90-day supplies.
Getting 3 months at once.
Right. For maintenance medications, things you take regularly, many plans offer lower per unit costs for a 90-day supply compared to getting a 30-day supply 3 times, especially if you use mail order pharmacies, which plans often encourage.
Fewer trips, maybe lower cost.
And we touched on this, but really double down on preferred pharmacy network utilization. Check your plan's directory. Using an in-network preferred pharmacy versus just any pharmacy can make a noticeable difference in your copays.
Got it. What about help from the drug companies themselves?
Yes. Don't overlook manufacturer assistance programs. Pharmaceutical companies often have patient assistance programs, discount coupons, or copay cards. These can dramatically reduce your out-of-pocket costs, especially for newer, more expensive brand-name drugs or those high-cost specialty medications.
How do you find those?
Often a good place to start is the drug manufacturer's website or ask your doctor or pharmacist. There are also some independent websites that try to aggregate this information.
Okay, and government help.
Absolutely. The biggest one is the Medicare Extra Help Program, also known as the Low Income Subsidy, or LIS.
Extra help.
If your income and resources are below certain limits, this federal program can help pay for your Part D premiums, deductibles, and copayments. It's estimated millions who are eligible don't even know they qualify.
Wow, how do you apply for that?
You can apply through the Social Security Administration website or office. And remember, those state pharmaceutical assistance programs, SPAs we mentioned, check if your state has one and if you qualify. Every bit helps.
Definitely worth investigating all those avenues. Now let's talk about the really big guns. Specialty medications. These are often breakthrough drugs for serious conditions, cancer, MS, rheumatoid arthritis, but they come with staggering price tags. How do you manage those within this system?
Yeah, specialty meds are definitely a unique challenge. They occupy that highest cost tier, tier 5 usually,
Right.
because they treat complex chronic conditions. They often require prior authorization from the plan before they'll cover it. Your doctor usually needs to submit paperwork explaining why it's necessary.
More hoops?
Sometimes, yes. And plans might also require step therapy, meaning you have to try one or more lower-cost preferred drugs first before they'll approve the expensive specialty drug.
Okay.
Optimizing coverage for these really requires close coordination. You, your doctor, the plan administrator, and often a specific specialty pharmacy that the plan requires you to use. These pharmacies have experience with handling these drugs and supporting patients.
And the cost. Is assistance even more critical here?
Absolutely critical. For specialty drugs, those patient assistance programs from the manufacturer, from independent charitable foundations, sometimes even hospital charity care, they aren't just helpful. They're often the only way people can afford these life-changing but incredibly expensive treatments. Pursuing these options aggressively is key.
So what happens if you hit a real roadblock? Say your plan flat out denies coverage for a drug your doctor insists you need. Maybe it's not on the formulary at all, or they won't approve the specialty med. Do you just have to accept that? Or can you sort of fight back?
You absolutely have the right to fight back. This is really important. Medicare Part D plans are legally required to have processes in place for you to challenge their decisions.
Okay, what are those processes called?
You can request a coverage determination, which is the initial decision. If you disagree with that, you can file an appeal. There are multiple levels of appeal, even eventually going outside the insurance company to an independent review entity if necessary.
So don't give up after the first no.
Definitely not, especially if your doctor supports the medical necessity. You can also request exceptions to the plan's rules.
Exceptions, like what?
Two main types. A formulary exception is asking the plan to cover a drug that's not on their formulary list, or to cover a non-preferred drug at a lower cost-sharing tier, a tiering exception.
And you need your doctor's help for that.
Yes, these requests almost always require a supporting statement from your prescribing physician explaining why the requested drug is medically necessary for you and why the formulary alternatives aren't appropriate. Understanding the prior authorization requirements we mentioned earlier is also part of this. Knowing what info the plan needs up front can help avoid denials and delays. Advocacy is key.
It really sounds like managing this effectively isn't just about picking a plan once a year. It's an ongoing process, and it feels like it should be part of a much bigger conversation about retirement planning.
It absolutely is. Optimizing your prescription drug coverage shouldn't happen in a vacuum.
Yeah.
It needs to be integrated with your broader healthcare and financial planning.
How so?
Well, think about how it connects to choosing between original Medicare with a Medigap and PDP versus a Medicare Advantage plan.
Yeah.
Your drug needs heavily influence that decision. If you have a health savings account, HSA, from your working years, how you use those funds in retirement might interact with your drug costs.
Right.
And it's definitely part of your overall retirement healthcare budget. Unexpectedly high drug costs can derail a budget quickly. Plus, if you're managing chronic diseases, your medication needs might change over time, requiring you to reevaluate your plan choices regularly. It's not static.
It's a dynamic piece of the puzzle. What about technology? We mentioned the Plan Finder tool. Are there other tech tools that can make this less of a headache day to day?
Yes, technology can definitely help streamline things. Beyond the Plan Finder, many pharmacies have mobile apps now that help you manage refills, track costs, sometimes even compare prices.
Oh, handy.
Some insurers' apps or websites also have tools to check formulary status or estimate costs. And think about your electronic health records, EHRs. When your doctors and pharmacists are connected digitally, it can help identify potential drug interactions or even flag opportunities for generic substitutions based on your health history and current plan.
So leveraging the tools that are already out there.
Exactly. Using the Medicare Plan Finder annually, maybe using your pharmacy's app, keeping your doctor informed about your costs, these digital tools can really simplify what might otherwise feel like drowning in paperwork and complex rules.
Wow. Okay, we have covered a ton of ground today. I mean, from really getting the structure of Part D, navigating the different phases, understanding the formulary and tiers.
Yeah, the donut hole updates.
Right, the donut hole updates, tackling those high-cost specialty meds, the importance of appeals. It's really clear that getting your prescription drug coverage right isn't a set it and forget it kind of thing.
Not at all.
It really takes ongoing attention, strategic thinking, and planning each year.
Indeed. And success here, it really relies on that commitment to annual plan evaluation during open enrollment, keeping those lines of communication open with your doctors and pharmacists, and really being proactive about using all the tools and assistance programs available.
Yeah.
The time you invest in understanding this area, even though it seems complex, it genuinely translates into potentially thousands of dollars in savings each year. And maybe more importantly, it brings peace of mind knowing you can access the medications you need.